Good afternoon, everybody. Thank you for joining us today. My name is Carmen Shepa. I'm the Dean of Bouvet College of Health Sciences. And as we see the ticker of our participants going up, I will get started just to make sure that we start on time. The hour will go fast, and we want to make sure that everybody has an opportunity to participate. So welcome to our webinar series on women who inspire at the forefront of healthcare. Today, we will engage in a discussion about the impact of COVID-19 on mental health and emerging strategies to support people through and beyond the pandemic. We invite and encourage the audience to ask provocative questions and generate ideas. Thank you to the planning committee who made this possible, and I would like to ask our colleague, Julie Norton, to just go over the ground rules for us. Julie, please.
Thank you, Carmen. Hello, welcome everyone. As we settle in, we wanted to share a few best practices for our event today. We will be recording the event, and the recording will be available after to everyone. To assist us in taking attendance, we ask that you try to have your first and last name listed on your participant window. If you're joining from a family's iPad or computer, you may have to rename yourself, and I'll post instructions on that in the chat. To raise a question or comment during this time, please use your chat window. You can type a question or comment at any time, and we'll address it during the Q&A session in the second half of the event. As a courtesy, please remain muted unless it's your time to speak. Dr. Elisa Lincoln will be moderating the session and reading out questions in the order that they're received. And you're welcome to unmute yourself if you want to ask the question yourself when called on. You're welcome to leave your webcam on during this time, as we love to see everyone's faces. However, you do not need to. And thank you very much, and we'll turn it back to Dean Shepa.
Thank you, Julie. And indeed, let me introduce our speakers today. Elisa Lincoln, who is a professor in health science, in social sciences and humanities and health sciences. She is the director of the Institute for Health Equity and Social Justice Research, and also the Associate Dean of Research in the College of Social Sciences and Humanities. Rachel Rogers is an associate professor in the Department of Applied Psychology in the Bouvet College of Health Sciences. And Suzanne Gaverich is Program Assistant Director at the Institute for Health Equity and Social Justice Research, and where she is also the Program Manager for the Northeastern University Public Evaluation Lab. So welcome, Elisa, Rachel, and Suzanne, and we really appreciate your being here today. And without further ado, I'll turn it to Elisa to get us started. Thank you all.
Great, thank you, Carmen. I'm really excited to be a part of this conversation today on public mental health and COVID. Yesterday, I had the privilege of speaking with about 100 Northeastern students who are engaged in our COVID pop-up class around COVID-19. And it really reminded me, it's one of the many strengths of Bouvet that we're having these discussions of mental health during this moment across these many forums. I'm really excited to facilitate the discussion because we're going to hear about two innovative projects that address mental health consequences across different populations, across different levels of analysis, and inform the development of possible interventions. I will also say that the Institute for Health Equity and Social Justice Research, as Dean Shepa mentioned, is the home to many scholars and students who from across Bouvet, as well as the university, engaged in these efforts. And we're thrilled that we get the opportunity to work with both Professor Rogers and Ms. Garbrick. So just a few comments to frame this important discussion. So as we all know, COVID-19 has impacted population and individual level mental health in many ways. There's the direct impact of having coronavirus. The longer we learn about this virus, the more we are learning about the long-term, both mental health and neuropsych consequences of the illness and its treatments. Many of us have been impacted by the stress and fear of contracting the virus, even if we ourselves have not had the virus. And lastly, there are the many consequences of measures to combat coronavirus, such as physical distancing, including associated social, economic, and political impacts. And the last one I will mention is mistrust. So we know that mistrust and distrust is very bad for our mental health and well-being. And this is a moment in the society where there are tremendously high rates of distrust of scientists, leaders, experts. And that distrust is also having an impact on our mental health and well-being. And we can talk more about that. So just very briefly, as Dean Sheppa said, I am someone with an appointment in sociology and public health, and I'm a sociology of mental health person. So I just briefly want to mention what stress is in that world. There's a rich sociological literature on stress. And just to remind everyone, because this is something that we all struggle with when we teach, that stress results from the need to adapt or change. And that need to adapt or change can be a good event or a bad event. And so a stressful life checklist includes things that we consider good events, like getting married, the birth of a child, getting a new job. But this is a moment where the disruption in our lives has been of a particular kind. It's a kind of disruption we've had little control over, and most of the disruption has had negative impact on our lives, leading to very high rates of stress. And these high levels of both individual and societal stress are linked to many physical health outcomes, or I call health outcomes, including both physical and mental health. And the coronavirus itself is an individual and societal stressor. Stress during the outbreak, as I mentioned, can include fear, changes in sleeping and eating patterns, worse chronic health problems, increasing drug and alcohol use. And these problems do not impact communities equally. We know there are groups of people who are more likely to encounter stress around COVID, including older people or people with chronic disease due to higher risk, children and teens, people who are helping with the response to COVID, like doctors and healthcare providers or first responders. We see the reflection of oppression and racism and the disproportionate impact of COVID on communities of color. And people who have mental health conditions, including problems with substance abuse, are disproportionately impacted. Additionally, the societal level stressors are having large impacts on mental health. The associated economic instability, unemployment and job insecurity, housing instability, disrupted social relationships, stigma and discrimination. And I'm just going to pause for a moment to note that many of us are well aware there's a rich and deep history that has demonstrated that racism, discrimination, and oppression are bad for all of our health and particularly bad for our mental health. And to just take a moment and acknowledge that I'm guessing many of us this morning have been watching the funeral of Representative John Lewis. And I'm really struck by his words this morning in the New York Times, which was incredibly moving, that ordinary people with extraordinary vision can redeem the soul of America by getting in what I call good trouble, necessary trouble. And so with that as a frame, I think this conversation could be an opportunity to engage in that. There's also, as I mentioned, fear, uncertainty, and distrust. So with this as the frame, I want to take 1 minute to just share with you what Mental Health America is finding. Mental Health America is a group that does mental health screening in a number of settings. Many of the students, I see some students on this call, have probably participated in National Depression Screening Day, as have maybe some of our faculty and staff. And they are finding large increases in people screening for depression and anxiety. They note that since February, they've had almost 90,000 additional positive screens for depression and anxiety, higher rates of substance use. Importantly for our community, these impacts are actually more pronounced in young people under 25. And even at the more severe or serious end of mental health distress, we're finding increased amounts of psychotic symptoms being reported among people. As we know that loneliness and isolation can be a huge predictor of depression, anxiety, and psychotic thought process. So I have one more thought I want to share before we move on, and that is a note on stigma, because I've been thinking about this a lot as a stigma researcher in recent weeks. So stigma is an attribute that is deeply discrediting. And I think we are, most of us, very familiar with that language. But I think what we're less familiar with, as is the research community, is really why does stigma exist and how do we prevent it from developing? And the stigma field has increasingly shown the need for interdisciplinary work in which Bouvet is poised to thrive, right? Bouvet is a perfect sort of environment to do this kind of work, to study stigma as a complex and multi-level process. But one of the things we have learned is that when people know the source of distress, stigma is reduced. And this is really important in this moment. So there's, at the Institute, we partnered with Nancy Kim in the psychology department many years, well, not many, but several years ago. And we did a vignette study where we looked at how people responded to people in a vignette who were struggling with alcohol or substance use. And in fact, when we provided an explanation for the increased substance use, such as the person had been in a motor vehicle accident or had a traumatic event, the respondents who read the vignette were less likely to respond in a way that reflected stigma, to express stigmatizing attitudes. And so one of the things that I have been so struck by in recent weeks is our ability to have different kinds of conversation about mental health and mental illness right now, as our entire global world is experiencing a stressor that we all understand. And I think that creates a space for a different type of discussion around mental health and illness. And so I just want to stop there and pass this off to Professor Rogers, who will introduce herself. But to say we will now hear about 2 examples of very timely and responsive projects that emerged very early after the COVID pandemic started. And then I look forward to the discussion. Take it away.
Thank you, Elisa. And thank you to everybody for having invited me to speak today. So as Dr. Lincoln was explaining, the current situation has had a huge impact on a number of core behavioral components in individuals' lives. And our research team that is entitled APPEAR, that stands for Applied Psychology Program on Eating and Appearance Research, is particularly interested in eating behaviors. And I would like, in the time that I have to talk with you today, to explain a little bit about the numbers of ways in which the pandemic and the context that it's created could impact eating behaviors in negative, but perhaps also positive ways for people. And then take you through some of the data, just very preliminarily, that we have been collecting to try and evaluate some of these effects. And before I start, I would be remiss if I didn't acknowledge several of the colleagues who are working on this with me, one of whom is Dr. Emily Zimmerman, who I see is with us today, as well as other members of my research team. And again, I see that there are several of the students who are with us today, and they may have other things to add when we get to the discussion point, although of course they may not. So the pandemic and the context that it's created through the social distancing and the restrictions to daily life in many ways has the potential to impact eating behaviors through a number of pathways. And I think it can be helpful to think about these in 3 broad areas. One of which is that eating behaviors for many people are influenced and affected by their impressions of the way their body looks or their body weight, their body shape. And so shape and weight concerns constitute one of the main pathways through which these effects can occur. A second one is that, as you may have noticed, eating behaviors are also influenced by emotions, and negative affect plays an important role in the way that individuals regulate their eating behaviors. And then the third pathway is anxieties related to health. Now, generally, when we think about determinants of eating behaviors, weight and shape concerns and the role of negative affect play predominant roles. But in this particular current situation, health anxieties may play more of an important role than they might otherwise in other circumstances. So I'm going to see if we can break down those 3 pathways a little bit more. If we think about weight and shape concerns, there are several ways in which the pandemic might have increased these. The first is that many individuals found that their usual life patterns, their capacity to exercise, and the way they were eating was radically modified by the restrictions that were placed on their life. And this for many exacerbated weight and shape concerns due to the perception that the situation might lead them to put on weight, or that they were being prevented from engaging in the behaviors that usually help them to regulate their weight. In addition, we know that media increases weight and shape concerns in a number of ways. This can be the general focus on appearance and weight that is prevalent throughout media. In this particular time period, there has also been an increase, particularly on social media, of content that is specifically reflecting these increased weight and shape concerns during the pandemic. There has been social media content that attempts to be humorous around increase in weight and weight gain during the pandemic that has referred to it as COVID-19, which is a spin-off of something that is commonly known as freshman 15, which is known to students as this phenomenon whereby weight gain sometimes occurs during the first semester. Just to debunk that, it's rarely 15 pounds. It almost never occurs in the way that people fear it will. But anyway, so that there is a parallel being drawn here with COVID-19 and things that are circulating that refer to the increased efforts people generally make to change their body weight and shape as summer occurs, and that they're going to be engaging in activities that they feel will reveal their body more so than usual. Another way that shape and weight concerns can affect eating behaviors is through the fact that they exacerbate the salience of food cues. And for people, for example, and we'll talk about this a bit more later, who suffer from binge eating types of symptoms, or who can feel loss of control around eating patterns and disinhibition when they're close to foods that they know are very appetizing for them, only being able to shop now and again can result in having a lot of food at home, and that can be quite distressing. And then finally, there is the fact that we now are all engaging in this way via video. And so the fact that people are aware constantly that they are going to be on video, that people are seeing on the screen, can also exacerbate appearance concerns to some degree, because it's a whole different level of management of appearance than people were used to in their lives previously. So those are some of the ways in which the changes related to the pandemic can specifically affect appearance concerns, which then can have a knock-on effect on eating. The other pathway I was talking about was emotion regulation and negative affect. And I think it has been amply clear, including in ways that Dr. Lincoln was talking about, that the situation has increased negative emotions for almost everybody substantially. And these are negative emotions that have arisen from not being able to be in contact with loved ones, from being deprived of usual social support or pleasurable daily activities, from perhaps the fear or even the grief of knowing somebody who has been affected by the pandemic, and also the effects of the disruption of regulation of other behavioral contexts that then impact negative affect. For example, exercise is a key way of regulating emotions, as of course is sleep, and all of those things have been disrupted. Lastly, I was mentioning health anxieties. There are some very specific ways in which health anxieties can perturb eating patterns. For example, an individual might hold beliefs that eating particular foods is going to be protective. There are foods that are commonly held to be anti-inflammatory or to have protective effects in the face of infection. And therefore, individuals might be very anxious to be supplementing their diets with those types of foods in an attempt to protect themselves against infection. And the other one is that there have also been increased concerns about food being a vehicle of infection itself, and therefore increased concerns about cleaning food, about storing foods in certain places for an amount of time before it's thought that the infection risk has gone down again. And all those things can affect eating behaviors as well. So those are the ways in which eating behaviors in the general population can be affected. Dr. Lincoln was making an important point about how some subgroups are particularly vulnerable to these things. And I'd like to mention the effects of food security or lack of food security on eating behaviors, and how those might also have been increased during the pandemic. It's known that individuals who experience food insecurity or live in areas commonly referred to as food deserts, where finding certain types of food, if not quantity overall, is difficult, experience more difficulties with their eating patterns than other people. And this is often individuals who have other vulnerability factors as well. And during this time of pandemic, these things will have been exacerbated. People who have difficulty accessing food will have had more difficulty accessing food. People who don't commonly have sufficient resources to feed themselves or their family will have experienced an exacerbation of that as well. And this is very important because it's known, for example, that in families where there is an insufficient amount of food for everybody, parents will willingly restrict their own intake so as to have more to feed to their children. And this all leads to disruptions in eating patterns across the family. And families are, in fact, another important vulnerable group to be thinking about during this time, because homeschooling and work from home has led to a lot of families' eating schedules to be profoundly disrupted. And this is disrupting to children, to parents, but also to the interactive factor of the family unit. And there are a number of ways in which these effects can occur. In very young children, parents have a reasonable degree of control over the way that they feed and provide food to their children. And during the pandemic, this can have been impacted in several ways. For example, not being able to shop as much may have led parents to stock up on things that we might consider to be sometimes foods. Brief parenthesis, but the word sometimes food is one that we like rather than calling things a treat, for example, because it takes away the valence, the connotation of something as being really appetizing but not allowed. And kind of emphasizes more a pattern of regulation over time where some things are consumed perhaps more often and some things less often. So we like the term sometimes foods. It has also, however, led to a number of parents doing much more meal preparation at home. And in the context of homeschooling, that means with children. And we know that engaging children in meal preparation can be a really good thing in a number of ways. It helps them to learn, obviously, how to cook for themselves, which is important in terms of their independence. But it also makes them more likely to try new things if they've been involved in making them and preparing them. It makes them more excited to have family meals and to stay and attend for the whole meal. And it also often leads to a more positive environment during those meals, which we also know to actually have positive effects in terms of eating outcomes or weight trajectories through some indirect pathways. However, we also know that parents are likely to have been negatively affected in a number of ways, as have families, through stress levels, through the difficulty of having to juggle the work from home, the homeschooling, the increased demands upon their time. And this may lead parents who themselves have difficulties with their eating patterns, perhaps on a general basis, to experience an exacerbation. And those may make it more difficult for them to be attentive to feeding their children in a healthy way. Or it may just mean that children pick up on the fact that parents aren't doing so well, that they're having more difficulty regulating emotion, regulating eating patterns. And this is something that is then learned by children as a behavior. So those are some of the ways in which families more specifically might be impacted. If we can, I hope I'm doing okay for time, feel free to cut me off at any point, but if we can perhaps go over to the slides that I believe are going to be brought up, wonderful. So I'd like to briefly share some preliminary findings, as I was saying, regarding some data that we've been collecting from families and particularly parents during this time. So if we can move forward, here we are. So we collected a sample among mums of young children. So these are children who are between infancy and 5 years. And we had 44 mothers who said that their babies were still breastfeeding, 63 mothers who said that their infants were still under 2 but had started at least partially eating solids, and then 166 who had children aged between 2 and 5 and so who were mostly eating solids and diversifying. If we can move on to the next slide, here we are. So these are some of the qualitative things that we found from the mums in our study. Firstly, I'm going to walk you through some of the things that they were describing about their own eating patterns, and then we'll see some of the things that they were saying about what they were observing in their children. So mums were saying to us that during the pandemic, they found themselves binging, they found themselves eating when they were upset, doing more nervous eating, eating more because of stress, experiencing more cravings for sugar, chocolate, just more chocolate, more binge eating, another person was describing, eating more things that are called junk food, that I might refer to as sometimes foods, and experiencing less self-control and less regulation around eating. However, if we move on, thank you. We also saw that they were describing some things that we might think of as more positive. So they were eating more foods that had been cooked at home, eating complete meals. They were trying to waste less. This to me was a very interesting thing. We know that in highly developed countries, there is a lot of food waste, and the unsuspected impact of the restrictions linked to the pandemic on food waste seems like a very unsuspected positive outcome. Mums were saying that they were cooking more, that they were being creative with their meals more than ever before, that they had not been eating fast food, that they had been more willing to cook meals and use the ingredients that they had at home, that they had been eating less meat and more vegetarian options, which is another thing that we know is associated with a more sustainable food environment as a whole and some positive health outcomes, and that they had more time to sit and prepare food with family. If we now move to things that they were saying thank you about their children, mums were noticing that their children were asking for more snacks, lots of snacking, wanting snacks constantly, they said, that children were eating out of boredom, that they had less consistent meal times, that some of them were noticing their children had more difficulty cooperating at meals, that they were throwing food more, or that their babies had been a little fussier. However, on the positive side, they were also saying that families were tending to eat better breakfasts because they had more time, that their children had listened to what they had to say and were not wasting food, that it was a period where they'd been trying more solids with their babies because mums had more time to experiment with purees and different types of foods, that they had been feeding more fresh foods, and were able to breastfeed more flexibly because of being at home, that their children were eating more variety than they might get at preschool, that they were eating more fruits and vegetables overall, and that families were eating 3 meals a day and together. So to some, thank you for those slides, it seemed like overall the pathways that we would expect do seem to be emerging, both in parents and in children. And these things that we might predict are going on in families. However, it does also seem that depending perhaps on the circumstances of the family, on socio-cultural location, on a number of those factors that Dr. Lincoln was highlighting that make people more vulnerable to these situations, some families were experiencing difficulties and others were experiencing areas of positive outcomes or of growth. And as we think about the overarching framing of this session in terms of how we can support people during this time and moving forward, it seems to me that there are 2 very promising areas. The first is that more or less across the board, everybody is experiencing difficulties of some kind in terms of eating patterns and regulation of these core behavioral contexts, and that helping people to find access to resources or developing specific resources for high-risk groups is going to be essential. The second thing, though, that I think would be interesting and useful is to identify those people who are reporting these positive outcomes and see if we can understand and harness what's going on there so that we can learn from them and help translate those things to other groups. Thank you, and I look forward to our discussion.
Thank you, Dr. Rogers. Next, we will hear from Ms. Suzanne Garbrick about the ongoing work with folks with more serious mental illness.
Hi, thank you. Thank you, Elisa. Thank you, Dean Sheppa, for both of you for inviting me to do this today and be part of this great series that is occurring this summer in Beauvais. So at the Institute for Health Equity and Social Justice Research, we have 5 cores, and one of those cores are areas of research. And one of those areas of research is public mental health and substance abuse research. And so we have a team in that area that focuses on public mental health. And we really wanted to, this led by Dr. Lisa Lincoln, and we really wanted to take advantage of this time to really learn about the impact that not only the pandemic has on people living with mental health issues or concerns, but also the impact that the quarantine and the isolation policies were having on people who were already dealing with mental health issues. So we created a survey and sent it around to Massachusetts mental health organizations such as NAMI, the Department of Mental Health, Depression Bipolar Support Alliance, as well as some peer and peer specialist organizations. And we also put it out in social media outlets to really try to get an array of people to respond to the survey. And we started the survey, we put it out in the beginning of April of this year. So, and I just want to note that we used a research method called community-based participatory research, where people, what this means for our survey and this research is that people with lived experience, so people with mental health issues, were part of creating that survey. So really community informed. So I'm going to ask for the slides to be put up. Thanks, Milan. And if we can go to the next slide. So this slide shows us who has participated thus far in the study. And so what I'm going to do is just talk a little bit about our preliminary data, like Dr. Rachel Rogers did, and pull out some qualitative quotes that people have conveyed to us about the impact that COVID-19 has had on their lives thus far. So far we've had 70 participants to fill out the survey. And this slide shows that the demographics of the participants, and they are, they have high levels of education, they're less financially burdened, they report being employed and housing stable. And one of our questions is, it's not on the slide, but if they have had to move during COVID-19, and the majority of participants have not had to move, so more housing stable. They also report having primarily overall good and very good health. So when looking at this data, we can look at it as the participants being in the best circumstances as possible during COVID-19. And from our data thus far, people's mental health are being severely impacted, even in the best case scenario. So we really want to, frame it like that. Our survey had several scales to assess the impact the pandemic was having on participants' mental health. We looked at the impact COVID-19 has on PTSD symptoms, stress, substance use, as well as loneliness and overall mental health. So 85% of our sample indicated that their lives had been disrupted some or a lot by the pandemic. And that's in comparison to 40% of adults in the US general population, which was reported by Kaiser Family Foundation. And even though we hypothesized that this would be true, that our population would be more impacted, but 40% is still quite a lot of being impacted by a pandemic. And that was really early on in the pandemic also, not after having months of be isolated and having just the impact of that pandemic, and the unknown and all of the unknownness that comes from the pandemic. We also found out that 72% of our sample indicated that worry or stress related to coronavirus has had a negative impact on their mental health. And this can be compared to 45% of adults in the US general population. Also, the majority of our participants who reported a negative impact on their mental health reported that this impact was major and not a minor impact. So we actually asked some open-ended questions to really get a contextual feel about what was going on with our participants. And so I'm going to read a couple of quotes that were pulled out about the impact that COVID-19 has had on these people's lives. So the first one is, the pandemic has felt all-encompassing, to the point where I feel that it touches every part of our lives in a negative way. I've also felt overwhelmed and anxious to the point of causing psychological symptoms. So really the impact is both a physical impact and an emotional mental health impact. This next quote is from a different participant. I'm afraid to leave the house to do regular and necessary errands. And when I return successfully, I have anxieties and fear a few days later that I've caught the virus, causing me to spiral or panic. I'm also forced to suspend important plans for my future, making me feel stuck. So if we can move on to the next slide. So this next quote really shows how the pandemic has really hampered people's coping mechanisms in terms of what they have used to really stay, to help with their mental illness or their mental health concerns or issues. For years, I have learned to control and have controlled my depression and PTSD by getting out into the community for several hours every morning. I went to see friends who worked at a coffee shop, and as well as being around other people. This also helped structure my day, and it got off to a positive start. Now I have no structure, and while I'm trying to come up with one, I haven't yet succeeded. And then this last one is really, we asked a question around isolation, the impact of isolation, and if people were feeling isolated and lonely. And this participant responded to this question by saying, yes, I've eaten more for comfort, gained a lot of weight, my blood pressure went up a lot from stress, had to increase meds for it, isolation very painful at times, caused feelings of anxiety, hopelessness, anger, and recklessness. So as seen by the quantitative and qualitative data, participants are reporting high levels of disruption in their lives and mental health, of their lives and mental health due to the pandemic. 62% of the participants reported some or a lot of changes in their ability to access and participate in wellness activities. When asked how the COVID-19 has impacted wellness activities in an open-ended question, which we're going to pull out a couple in a second, many people included not only the wellness activities that were no longer possible, but they, without being prompted, talked about all the ways that they have adapted and created new wellness activities during the pandemic, showing the amazing resiliency of the participants. So this is also backed up, the resiliency of our participants is backed up by the quantitative data, where people scored high in the resilience coping score scale, which illustrates higher levels of resiliency. So we could move to the last slide, please. So I pulled out some quotes that really shows the way that people were able to pivot during the pandemic in terms of the wellness activities that they use and the coping mechanisms that they use. So this one participant says, because of my disability, I used to swim 2 times a week for safe exercise. Now that the weather has changed, I will be doing some vegetable gardening in the backyard, stretching, walking through dogs around the backyard. So really using their environment, even though they're isolated, to be able to do some coping mechanisms and some healthy wellness activities. This next participant says, I have been using my meditation app more because I have the time, which is, I think, a great coping skill. And the third one is, person says, due to the pandemic canceling my plans, I've had more time to join fitness classes virtually and watch cooking videos online. So really taking the opportunity to use this time to create more wellness activities. We also learned in the survey that the participants are skilled in knowing how to take care of themselves. And when asked, they shared some of their coping mechanisms and tools that they use, and that they really wanted other people to know to use during this time of the pandemic. And some of those suggestions include, which I think we can all take advantage of, is exercising, taking walks, keeping a daily routine, starting a project, listening to music, reading, meditating, praying, relaxing, staying busy or distracted, and engaging socially via technology. So our hope is for our next steps so we have submitted the survey to get funding from a Participatory grant mechanism. And we would really like to increase our diversity in the participants to understand the impact the pandemic is having on a variety of people living with mental illness. So we would like to reach out to people of color, as well as people with lower socioeconomic status, such as participants with lower levels of education and economic resources, to really get an understanding of how this pandemic is impacting people with mental health issues. So thank you. I'm looking forward to the discussion and questions.
Great. I just really want to thank you both. Those were both really helpful and positive presentations. And I noticed that both of you also really took a strength-based approach, right? So many of you probably noticed my introduction delivered some bad news that we all know, we're all feeling it every day, the impact of this on our own mental health and well-being. But what I really appreciated about what you both spoke about is that while acknowledging this is a difficult time, in both projects, there were ways people acknowledge the innovative and creative solutions people are coming up with to take care of themselves and their children. And I would just expand to that and to say their communities. And there's been a lot of that going on. And that also helps on mental health. So now to the questions. It looks like our first question was about whether the information today will be shared more widely. And we are absolutely happy to share pieces of this, and I can work with Julie on that. Carolyn Stiles, would you like to read your question? All right, I do not hear her, so I think I will go ahead and read it. What mental health challenges do you anticipate when we have to go back to commuting? Oh, I see you now. Do you want to finish?
Yes, and the last speaker just hit on it, that a lot of people have taken advantage of the extra time that they have at home and they don't have to commute. I have, and I'm exercising more, and I've found new ways to not only do exercising, but different other things that I enjoy. And yes, the isolation is an issue, but I sort of foresee that the whole transition of going back to work for a lot of people is going to be also very stressful, in realizing now we don't have all this extra time that we have had. It's been kind of a gift. I know there's been a downside, but what do you anticipate are going to be some of the fallout from that?
So Rachel, since you have the clinical background, do you want to take that one first, and then Suzanne and I can speak to a little bit what we see on the research side? Oh, you're muted.
You missed it. I just said something wonderful.
Brilliant.
So going back to what you were saying about the strengths-based approach, I think that I have hopes and fears about the transition back to work. It is possible, and I guess I don't know if this is a hope or a fear, but that things never go back to the way they were before. And so no one is going to be in a situation of having to readjust into where they were previously. It's going to continue to be an adaptation towards something new. And this will most likely be stressful because it'll be a change. Changes are stressful because there will be unknowns, because there will be fears around the fact that the pandemic most likely will still be with us. But it also means that there is continued opportunity for growth. And we know that one of the things that's interesting about behaviors is that they form into habits. And for some people, this is easier than others. But once a behavior is a habit, it requires little deliberate effort to sustain. And so it's possible that for some people, these new habits and perhaps the new values and the positive emotions that have become attached to them will allow them to sustain, even if the situation has changed in a way that doesn't support those behaviors in quite the same way. The other, of course, possibility is that indeed the continued need to adapt to yet another new situation will be difficult for people, particularly people for whom that flexibility is most difficult anyway, and that for them it will be yet another challenge. And so I think that one of our challenges is to think about how we can anticipate that and try and support them as much as possible. You raise a wonderful point.
Thank you.
Yeah, and I would just follow up on that. Again, I'm not a clinician, I'm a public mental health researcher, but in a talk I gave last week with some experts on PTSD, there was some really important and interesting discussion about the experience of this pandemic as a traumatic event and what that means to then re-enter into a community where, you know, we in public health, in order to sort of get everyone to put their mask on and socially distance, we scared the heck out of everybody, right? That's part of the strategy to get people to, you know, adhere to public health practice. And now we're saying, now that we convinced you to do this, now we want you to go back out there. And for many, that will be a traumatic event. And so I think these discussions around what it means to be a trauma-informed school, what it means to be a trauma-informed healthcare system, what it means to be a trauma-informed university, are discussions some of us have been having for a long time, but in this moment, we're going to need to think about that at a societal level in order to really have this transition be one that is more positive and has post-traumatic growth. Okay, I'm just looking, am I missing? Oh, what are your thoughts on telemedicine during this time for counseling and addiction services? Suzanne, do you want to speak to that briefly based on our survey? Because I know some people did talk about that.
Yeah, so some people talked about, it was interesting. So we asked, so a lot of people, most people are doing telemedicine health now in our survey. And there was some hesitation about doing that in the beginning of the pandemic. And they reported issues like not thinking it was going to have the same impact as a one-to-one meeting or in-person meeting with their therapist or counselor or provider. And they were unsure about the technology and just concerns around technology and the ease of it. But I'm actually wondering how people would answer those questions now after doing telemedicine for a couple of months and people kind of getting in the flow of things. But there was some hesitancy at first of our participants who didn't want to use that method and really wanted to do in-person meetings.
And I will just add to that, and Rachel, I don't know if you have additional thoughts. Two other thoughts that are coming up about that in the public mental health world. One are that that's been a very tightly regulated field. And as Rachel, Professor Rogers pointed out, some of these changes are going to persist post-COVID, and it'll be interesting to see what happens to that. But I also think we have to acknowledge the digital divide and remember that not everyone has equal access or comfort with technology. We're working with groups that support elders around isolation, and they're struggling thinking about how do you use technology to support elders around isolation. I think I would stop there. Rachel, do you have any thoughts on that?
Mostly that I agree with you. And that I think, again, this is where we see the moderating effect of people who have resources and flexibility and networks who can assist and those who don't. And one of the things that's been astonishing to me is not only how fast the technology has grown to accompany us through this time, but also how it has moved people who didn't engage in technology for whatever reason to engage in it in very effective and proficient ways. And yet other people who continue to lack the resources or the access in just the ways you were describing.
Absolutely. Thank you for that note about right? I think there has been a training up of professionals around telemedicine and technological supports and interventions. With students going back to campus and new normal, how can we prepare students with coping mechanisms or programs to assist them? Well, that is a fabulous question. And I think Bouvet has a large role to play there if we think about the disciplines that, and we have expertise within Bouvet. One thing I've been thinking about a lot lately is I do think we need to do a better job of engaging with students themselves to lead these efforts. So I think there are things that faculty and staff and leadership should be doing, but I also have been speaking to many students who are also engaging in efforts themselves to change the culture on campus around mask wearing and social distancing. And I think this is a real moment to really partner with students in this process. And I think, my comments about stigma are probably important here too. That the more we have these discussions and the more we acknowledge that in this moment, many more people are experiencing distress and having mental health issues and problems, but that is always the case and we just don't talk about it. And that, this is a moment where more of us are talking about it. I think that will be helpful to our students. I'm curious if other people, we have so many experts on this call, on this screen, I'm looking, if people have other thoughts on that one.
Yeah, I thought this is fantastic. Thank you so much for all.
Oh, you're welcome.
One thing I thought helpful, I just borrowed yesterday from our state discussion, school psychology discussion, which reflected what people learned, what other states are doing, and the Department of Education and the APA, which is American Psychological Association, and NASP, National Association of School Psychology. So all of these organizations are exploring the same issue and concerns we're discussing today. So Absolutely. Some thought we could borrow one of the ideas I thought, because I'm more influenced by the multicultural angle, is that actually each culture, each community have already people develop certain kind of a coping strategies and helping each other. And some people have this online group, like I know many Asian Americans have WeChat groups online, and other people have Facebook or other. So they're already forming their support system. I think using their already existing supporting system definitely would help support our students. Our students would have that. They have belongs to certain kind of organization. The other is that I thought Lisa just talked about just a wonderful point that other people also recognize is that we engage our students and our faculty leadership, staff leadership, and student leadership together, kind of people know the facts, know the challenges, know different people's adaptive approaches. So acknowledging all that itself also supporting each other is very empowering. For instance,
Absolutely.
yeah.
No, I think, I think that is all exactly right. And I really appreciate your reminding us that there are so many groups of professionals and communities and peers all working on these things at the same time, and to sort of share the wealth and connect. You know, the other thing that you made me realize is one thing I did not mention is that in mental health, people often forget about prevention, right? In public health, we talk about prevention all the time. And in public mental health, you know, in the clinical field, prevention is less discussed. And I think this is a moment for us to look at the lessons we've learned in the past about about mental health promotion and the prevention of mental illness. And we actually know a tremendous amount. And I think thinking about those things as students come back and as people ease out of COVID, whenever that will be super important. Whether it's social connection, like you were just mentioning, or thinking about the larger things on a societal level, employment supports for, you know, as Professor Rogers talked about, right? Food insecurity is not only affects eating behaviors, but, you know, has a huge upstream or downstream, depending on which version you use, impact on all aspects of mental health and well-being, right? So I do think we need to be thinking about promotion and prevention. So Tia Keck, do you want to read your question?
Sure. I know we've talked a bit about the difficulty some people have getting food during this time, and that behavior has changed a little bit. Some people eating healthier, some people eating not as healthy. But I'm curious whether anyone's looked at whether that $600 a week extra for unemployment payments affected food choice, like in food purchasing. Did people buy more fruits and vegetables? Is there any information on that?
I'm going to look at Rachel Rogers on this one.
That is a fantastic question.
Yes.
I have to say that I'm not aware of anybody who's assessing that. I do know of colleagues who are looking more specifically about the impact of the situation on people who were already experiencing food insecurity, but not so much on changes to behaviors among people who have been receiving that. So that, I mean, that is a lovely question. Let's gather some data.
Yeah, and I think that's a great question. I know I have colleagues in the economics department and the School of Public Policy and Urban Affairs who are looking at exactly these types of questions. And again, it's a great opportunity for this, you know, kind of cross-college interdisciplinary collaboration where Bouvet brings the real expertise in health and thinking about food choice and food insecurity in that space. Oh, there's some questions flying by. Can Cara Dalton, do you want to read your question?
Sure, yeah.
Thank you.
Hi, sorry, I'm just going to try to put my video on here. So my question was, I know we're talking a lot about university age students, so I was wondering if any of you could speak to the challenges of children, specifically K through 12, returning to school in this new normal, where they will be expected to attend classes both in person and in a hybrid format online. And how can we specifically equip primary and secondary level teachers with the tools to help their students with all of the challenges that will come from again, a very disrupted school schedule and just trying to navigate all of those challenges. I was just curious to talk a little bit about that population, because I came from that world before I joined higher ed. So I was just curious. Thank you so much.
Yeah, that's another great and incredibly important question. And I don't know if Suzanne or Rachel have any thoughts on that. I will just say that there are absolutely folks in Beauvais who actually work in those areas, and that would be a great topic for another forum as well. But I think the areas of K through 12 that I'm most familiar with are in fact public mental health promotion and mental illness prevention programs that take place in those settings. And I guess this sort of gets at the question Jackie asked as well, what strategies are in place? And I think this is a moment to look at the depression prevention campaigns that we use in late elementary school and middle school, the stigma reduction programs we do in those settings. Although I would add, schools are going to be particularly overburdened this fall, and the idea of asking teachers to take on mental health promotion is an additional burden. So I think it involves investment in different types of resources. Lastly, I will say though, to get back to the trauma-informed schools, I think this is a time where the work that many people have done on how to create trauma-informed schools would go a very long way in this moment. I don't know if Suzanne or Rachel have other thoughts on that.
Again, sorry, Suzanne, are you going to say something?
No, you go first. You
okay.
First.
Just that it was also linking in with Jackie's question also about the prevention and the broad strategy. So there are actually, you can count them on the fingers of a hand, the strategies that are effective in terms of mental health prevention overall. They fall into these very broad categories. And I think that really looking to those and thinking about how things like learning core emotion regulation skills or kind of really core cognitive skills can be helpful across the board, and thinking about how they can be incorporated into systems, schools, but also other systems in this new world, and how we can sort of, again, anticipate and see if we can think to informing our different contexts.
Yeah, I mean, I also think it's about, educating people about mental health hygiene and what goes into that. And when I think about that, I think about, physical things that impact your mental health. Like, I mean, some of the things are more emotional, like emotion regulation and cognitive thoughts and things like that. But then if you think about the physical things like sleep, like having a sleep regime is really important for mental health, eating well, all those things that we, getting physical exercise, getting out and socializing, right? All of those things impact our mental health, and really educating people, and not, again, not putting it on teachers, but educating people and students and families and everyone about those important aspects that can prevent mental health issues.
So I really just want to thank this group for our presenters, Professor Rogers and Ms. Garbrick, for their excellent presentations. This has been a really great discussion, which is often for me, I will say, challenging in these large Zoom calls. So I appreciate the questions and the participation. I want to wrap up, since I'm being respectful of time, by mentioning the next in this forum, but it has gone so far up in the chat that I can't find it. So I'm wondering if Julie Norton or Milan would just like to remind everyone when the next event is.
Sure, I can do that. Thank you so much, Elisa, for your time, and Suzanne and Rachel. Next Thursday, same time, same place, we'll be looking at career paths and in the school in pharmacy, and we're going to be hearing from 2 alumni from the School of Pharmacy and their trajectories, coming from the School of Pharmacy at Northeastern and where they are now. So it looks like a great presentation. So we hope to see you there next week.
Great, thank you. And I just, in keeping with the topic that we're discussing, I want to encourage everyone to take care, stay connected in the ways you can, ask for help when you need it, and err on the side of asking too often and for too much. Because these are challenging days for all of us. So please take care. And I know many of the names on the screen. I know many of us are taking care of ourselves and lots of people. And I hope you'll all continue to be well during these tough days. Thanks, everybody.
Thank you.